info. Go ahead, ma'am.
Yeah. Good afternoon, everyone. I'm Dr. Poornima Mathur, and as usual, I've come to discuss a topic. आज का जो topic is not very pleasant. Failed IVF. What next? IVF, जैसे हम सब सोचते हैं, that is the ultimate step to achieve our fertility solution, हमारा parenthood का dream realize करने के लिए. And if that does not work for us, तब बहुत सारा वो अपने साथ disappointment लेके आता है. But obviously, our ultimate goal is still parenthood. We cannot give up on that. So, how do we proceed next? How can we work on it? And so that next time हमारा जो outcome हो वो हमारे favor में हो. What are the different options that we have available? वो ही हम discuss करने जा रहे हैं कि fail IVF के बाद हमारा approach कैसे होता है. So सबसे पहला question that comes to our mind is why did it not work for us? Why did it happen? Why was our result negative? And the next question that comes to our mind is what next? What are we supposed to do next? The IVF was a thing that we wanted to do. That was our ultimate step. And if that does not work, how should I proceed further about it? So before we go ahead, it is very important कि हम realize करें कि IVF की success rate 100% नहीं होती है. अगर हम इंटरनेशनल पैरामीटर्स देखें इट वुड बी समवेयर अराउंड 40%. हम हमारे ओएसिस के स्टैंडर्ड्स में देखेंगे इट वुड बी समवेयर अराउंड 60 to 70%. एंड डिफरेंट फैक्टर्स हैं जो ये डिटरमाइन करते हैं कि हमारी आईवीएफ की सक्सेस रेट क्या होगी. सबसे इंपॉर्टेंट बीइंग द एज ऑफ द मदर. भी हमारे एग्स ड्यूरिंग द आईवीएफ स्टिमुलेशन हमारे एग्स कैसे थे, क्वालिटी कैसी थी. वी कैन नॉट फॉरगेट द पार्टनर का कॉन्ट्रीब्यूशन, स्पर्म पैरामीटर्स हमारे ये सब कैसे थे, हमारे एम्ब्रियोज की क्वालिटी कैसी थी, वेदर हमने डे 3 एम्ब्रियो ट्रांसफर किया था या डे 5 एम्ब्रियो ट्रांसफर किया था. Is there any other cause or factor that was leading to IV infertility? हमारी एंडोमेट्रियम कैसी है, इम्यूनिटी एंड दी जेनेटिक्स. सो अगर हम देखें वेयर द इम्प्लांटेशन डज नॉट वर्क, अगर हमारी 2 से ज़्यादा हमारी प्रेग्नेंट एम्ब्रियो ट्रांसफर्स हम 2 बार कर चुके हैं, इट हैज़ नॉट वर्क, ट्रांसफर गुड क्वालिटी एम्ब्रियोज एंड हमारा बार बार इम्प्लांटेशन फेल हो रहा है, तो उसके लिए हमारी बहुत सारी गाइडलाइंस हैं हाउ टू प्रोसीड अबाउट इट. वन ऑफ देम बीइंग हमारा कि हमें लाइफस्टाइल फैक्टर्स को रिविजिट करने की ज़रूरत है. हमारे वी हैव टू रीअसेस द एंडोमेट्रियम, हमें बाकी ब्लड फैक्टर्स इवैल्यूएट करने की ज़रूरत है. The other things being the karyotyping of both the parents, हमारे अल्ट्रासाउंड्स यूट्रस को इवैल्यूएट करने की ज़रूरत है. The endometrial factors and the other tests that are not needed and not indicated per se as per our guidelines. So सबसे पहले अगर हम देखें तो we have the maternal factors and the embryonic factors. So maternal factors में mother की age being the most important, जिसको हम modify नहीं कर सकते. The uterus की anatomy हमें reassess करनी होती है. Is there any problem with the uterus? हमारे fibroids है multiple. Is there any septum? छोटे micropolyps है. Is there any PID that we are suspecting it? Adenomyosis, endometriosis. What are the factors that are contributing to decreased success rate हमारे? Any existing thrombophilias हैं, immunology है, या endometrium हमारा हमारे हिसाब से नहीं बन रहा. Now the endometrium is a detailed topic in itself which we can discuss in some other lecture हमारे. But there are different factors that we assess in the endometrium. The thickness, what is उसकी कितनी thick हमारी endometrium बनी है, उसकी हमारी एंडोमेट्रियम की मॉर्फोलॉजी कैसी दिख रही है एज पर दी साइकिल ड्यूरेशन की हमारी at a particular point in a cycle, how is my endometrium supposed to look and how is it looking per se. The blood flow in the endometrium कि हमारे यूट्रस की लाइनिंग में हमारा अंदर ब्लड फ्लो कैसा जा रहा है. अगर हम एम्ब्रियोनिक फैक्टर्स देखेंगे तो देयर वुड बी डिफरेंट लाइक द जेनेटिक्स, हमारी एग्स की जोना कैसी है, एम्ब्रियो कल्चर में हमारे कैसे ग्रो कर रहे हैं, डू वी गेट अ गुड क्वालिटी एम्ब्रियो और नॉट, आर दे जेनेटिकली नॉर्मल और नॉट. Then there are male factors which contribute कि हमारे sperms कैसे हैं. Sperms apart now that we are doing एक सी हम कहते हैं हमें motility and इन सब का नहीं, हमें इतना major factor नहीं है. But the quality of the sperms is important कि हमारे वो genetically healthy sperms होनी चाहिए. What was the method of sperm retrieval? क्या अगर हमें टेस्ट से माइक्रो टेस्ट की जरूरत पड़ी? Does the husband have any associated medical comorbidities like obesity है, अगर diabetes है, we are on certain medications, drugs है, smoking है, alcohol है, these all can impact the quality of these sperms. Now this we'll discuss right now only how do we go about it. Now अगर कोई भी फैक्टर ऐसा है मेल में विच वी थिंक कैन बी अ कॉन्ट्रीब्यूटिंग फैक्टर टू हमारा पुअर आउटकम, इन दैट केस वी कैन एक्चुअली असेस इट फर्दर विद द हेल्प ऑफ अ डीएनए फ्रैगमेंटेशन इंडेक्स, जो हमें बताता है कि वो जेनेटिकली कितने हेल्दी हैं. And if in case it is high, the husband can be put on a lifestyle change के लिए treatment दिया जा सकता है. The associated medical comorbidities can be brought under control. And then when we are going for a repeat treatment, then we can actually use some advanced semen preparation methods like microfluidic या MAX to select the most healthiest sperm for our egg to fertilize. Okay. So now the main question that comes to us again is, now when do I start again? So it all eventually depends upon what is your particular case. Kya tha? How long did it take? Is there any, say for instance, if you have a fibroid or endometriosis, or did we have a good embryo, or the embryo was a problem, or the lining was a problem? Depends on your particular case. जो आपके fertility consultant आपको guide करेंगे कि what should be the gap and how should we proceed about it. Ideally, a 4 weeks gap would help you heal better. The gap is not only needed हमारे physical उसके लिए, but apart from that, there are emotional. The impact of a failed IVF is not just physical; it can affect you emotionally and financially as well. So depending all these factors would help you take a call when to start. On an ideal, उसमें हम देखें तो 4 weeks of gap is good enough to start again. And what can be done now? How do we things? How do we make any changes? How do we make things happen differently so that we get a positive outcome? The first important thing is going through your IVF records. Now, this is what we as the fertility consultants would do to reassess from the beginning so that no point is missed. The stimulation that includes determining what was the initial indication where we started with the IVF, any lifestyle factors that we need to change before we start with the second cycle. The response आपका अगर self stimulation वाली cycle थी, so we go ahead and see कि what were the injections used, dosage हमें कितनी ज़रूरत पड़ी थी, is there any changes that we need to make in that particular stimulation protocol, the quality of eggs जो हमने retrieve किए थे, how were they, what was the embryos का status, embryos के हमारे number कैसे बने थे, whether they were a day 3 embryo या whether they were day 3 embryos or day 5 embryos, and what was the quality of the embryos, हमारी grade 1 थी, grade 2 थे, grade 3 थे. That would help us get an insight into what could be corrected in that particular stimulation protocol that we are going to use for you. Apart from that, one of the most important things is the uterine anatomy, the uterine factors, which can be evaluated simply with the help of a 3D ultrasound. आप जब अपने consultant के पास जाते हो, machine में सिर्फ हमें एक probe change करना होता है, and we can have a 3D view of your uterus and your egg nexa. 3D ultrasound, we'll discuss in detail a little later on, is helpful in detecting any pathology that we are suspecting in the uterus, which can be later confirmed with the help of a hysteroscopy. At times, in people who have endometriosis or some tuberovarian mass due to tuberculosis or anything, laparoscopy may be needed to overcome those factors. If there is persistent fluid in the cavity, तो भी a laparoscopic evaluation will help us determine the cause and treat it as well. The investigations might be needed for thrombophilias, and the genetic analysis might be done to help us get a positive outcome. So there are immunological factors which are not recommended by X-ray but are offered, uterine NK cell, immunoglobulins, and a detailed evaluation of the endometrium. The endometrium may the ERA test and the receptivity. Now this we'll discuss in detail. So when we talk about the 3D TVS and a hysteroscopy, 84% cases में accurately आप एक 3D अल्ट्रासाउंड के साथ डायग्नोज कर सकते हो यूट्राइन एब्नॉर्मैलिटीज, स्पेशली इन इनफर्टिलिटी केसेस में. जिनमें हमें कुछ डाउट होता है उसमें you can actually proceed further for hysteroscopy, which will help you correct it as well. So a 3D ultrasound gives you a detailed information about the uterus, the adnexa, any mass that is suspected, any septum that you are looking at, or polyps. Hysteroscopy can be used as both diagnostic and corrective. If आपको 3D ultrasound में लग रहा है there is some pathology, it can be confirmed and corrected with an hysteroscopy. And there are studies which have shown that pregnancy rates appear to be increased when hysteroscopy is performed in a failed IVF cycle patient. So now let me talk something about the window of implantation. Now, इस पूरे IVF में when we say okay we've got a good embryo, we've got a good lining, there were no major abnormalities per se. Our doctor said it is good. The only thing in an IVF cycle that is left on chance is the implantation. Now, implantation जो है हमारा that is embryo का चिपकना in the uterus की lining. Implantation is a very critical and बहुत ही precise process होता है. Where हमारे ये embryo आता है, you can see in the image, embryo hatch होगा, वो अपोज होगा एंड देन वो अडेयर करेगा हमारी एंडोमेट्रियल लाइनिंग से एंड फाइनली वो इन्वेट करके इम्प्लांट हो जाएगा. नाउ दिस इज इम्प्लांटेशन एंड यूजुअली द एंडोमेट्रियम is receptive for implantation for a certain particular amount of time. That is known as the window of implantation. तो ये विंडो ऑफ इम्प्लांटेशन अगर आप देखोगे इज नॉर्मली जैसे आपके एम्ब्रियो ट्रांसफर होता है. इफ इट इज अ नेचुरल साइकिल LH राइज के साथ 7 डेज के बाद या प्रोजेस्टेरॉन स्टार्ट करने के डे से 5 डेज बाद हमारा इज द विंडो ऑफ इम्प्लांटेशन. नाउ इन सर्टेन पीपल इन सर्टेन केसेस ये विंडो ऑफ इम्प्लांटेशन या हमारा नैरो हो सकता है या वो छोटा हो पहले आ सकता है. इट मूव्स फॉरवर्ड और इट मूव्स बैकवर्ड. Now, this is where Hamari, if everything is right, our endometrium is just not ready for the embryo to implant. And if we can find out this window of implantation and go ahead with the personalized embryo transfer, it might help us in people with previous implantation failures. So now ये हम पता कैसे करते हैं? That is done with the help of an ERA test. Now what is ERA test? ERA test is basically हम आपकी यूट्रस की लाइनिंग को प्रिपेयर करते हैं just like we would go ahead with an embryo transfer. You're given medicines when we feel everything is optimum. हमारे uterus की endometrium जो lining है, the thickness is good, the blood flow is good, and in another circumstances हम उसमें transfer embryo करने के लिए we would have found it suitable to transfer an embryo in that lining. That is when we go ahead with the ERA. Now everything is done similar to embryo transfer, just that instead of embryo transfer, we take out the endometrial sample and send it for analysis. Now, जब ये sample जाता है, it has detailed genetic analysis and molecular analysis, and a report is prepared. We get a report whether if we go ahead with a transfer according to the same protocol, whether the endometrium is receptive to implant the embryo at that point of time or not. And if in case it is not receptive, what would be the receptivity window? Say for instance, it is usually around 120 hours after the start of progesterone. अगर मेरी विंडो डिस्प्लेस्ड है, it would give me an accurate window कि instead of 120 it can be transferred at 136 or 144 hours, or it can be transferred at 118 hours, 116 hours, depending upon how is the window displaced. And it is a painless test done without any anesthesia with the help of a People's biopsy curette that we take the endometrial sample. Various studies have shown that ERA test done in women with recurrent implantation failure, which may improve the success rate and the clinical pregnancy rate. Next, that comes to an important thing that can be added into our further treatment protocol is the genetic testing of the embryo. Now, when we go ahead with the trophoectoderm biopsy, it significantly improves the success rate in advanced maternal age. So what is basically a pre-implantation genetic testing is ये जो हमारा embryo day 5 day 6 पर बनता है उसकी जो अगर आप देखोगे एक है trophoectoderm cells outside and अंदर है inner cell mass. इस trophoectoderm cells की को हम hatch करके थोड़ी सी cells हम genetic testing के लिए भेजते हैं. They can be used to detect any aneuploidies in the embryo that we're suspecting of, or any monogenic disorder that we want to diagnose in the fetus and then go ahead with diagnose in the embryo and then go ahead with an embryo transfer. So pre-implantation genetic testing में हम biopsy लेते हैं, we go ahead with the genetic analysis, and when we get a genetically normal embryo, that is where we go ahead with the embryo transfer. Different types. As I said, एक aneuploidy होता है, most useful in when you are at an advanced age, a monogenic or a single gene disorder, or a structural rearrangement screening. Now, certain we have some limitations and some advantages as well. We know that PGTA would improve our success rate in advanced maternal age. At the same time, if we are a carrier of any particular monogenic disorder, we can get it detected so that हम avoid कर सके उसको अपनी progeny में transfer करना. But एक चीज हमें the limitations that we have to remember that all cells in an embryo they do not demonstrate aneuploidies, that is chromosomal abnormalities. कुछ cells में दिखेगा कुछ में नहीं दिखेगा, that is a mosaicism. And next we have to remember that the truth, it does not necessarily mean that though the chances are significantly improved that it is a genetically healthy embryo, there is still a remote possibility कि हमारी ट्रोफोइक्टोडर्म की cells में से जो हमने biopsy ली है that does not correlate well with the inner cell mass and there might be some discrepancy later as well. So this genetic testing in advanced age is definitely going to help us out improve the success rate. So, if we have to summarize, if we have a failed IVF that we are dealing with, it is very important you on your side go revisit your lifestyle, make some necessary changes, get into an adequate weight, get your eating well. Any medical conditions that you have need to be in control. Discuss the quality of embryo with your fertility doctor. What is the quality of your embryos? Now, at times, because of advanced, if somebody is in the age of 40, 42, where we are struggling to get a good quality embryo, because the biopsy would be still possible only when the embryo is also of good quality. It has to be a day 5 embryo. So, if we are struggling to get a good day 5 embryo, in that case, the help of a donor whose site can be taken or else changes in the protocol need to be made and maybe a restimulation will help you get a better embryo. So it is important that we see what is the quality and the grading of our embryo. The uterus needs a detailed evaluation for any structural abnormalities or any polyps or any inflammatory changes. The endometrium needs to be reassessed. That would include the thickness, blood flow, and all the details, plus the endometrial receptivity. Genetic analysis of the couple or the embryo may be done if the couple is at an advanced age or there is history of recurrent failures or recurrent losses in the early stages. That's it for today. Thank you so much. And please remember, failure is only an opportunity to begin again. So be wise, choose your fertility center properly, discuss in details about your plan of action that gives you a little, that lessens down your, soothes your anxiety. If you have any questions, please feel free to reach us. We have all the solutions and we would be happy to guide you. I think they have no questions. If you have any, you have our fertility helpline number is reflecting on the screen right now. You can reach us out on that number. Thank you so much.